Let's talk about my favorite made up Botox aftercare rules. So, I'm sure you may have heard somewhere along the line, don't lie down, don't bend over, don't go exercise after, don't drink wine, don't live your life. But is there actually any evidence behind any of these rules? I'm Dr. Victoria May. I'm a board certified plastic surgeon in Scottsdale, Arizona, and today I'm going to talk to you about my favorite made up Botox rules. Historically, patients have been told not to do certain things with the fear that the Botox or whatever neurotoxin they're being injected with is going to migrate or is going to ruin their Botox result. The idea behind this was that the Botox could migrate into unintended muscle groups if there was any sort of movement, or it could migrate with gravity. But the problem with that was that there was really no strong evidence to support these rules, but they became so routine that people would just expect them, that they couldn't go lay down, they couldn't go work out, and they just knew that these were the rules of Botox. So interestingly, there was a study that came out in 2025 that actually looked at this exact thing. So they studied over 5,000 patients, and what they did was they said, we're going to watch you for about 10 minutes after your injection, and then after that, you can go do whatever you want. And then they followed any sort of complication that happened. And what did they find? So they found that there were no cases of eyelid ptosis, which is where the eyelid comes down. They also found that there was only about a 6% complication rate at all, which is lower than what we see in the literature in general, and that over 90% of patients were happy with their result. So their result was that these extended instructions after having a Botox or similar treatment is probably unnecessary. And interestingly, if you look up Botox on their manufacturer website, there are no specific rules for aftercare listed, such as not laying down, not exercising, not drinking alcohol. So, my favorite made up Botox rules. Number one, that you can't lie down or bend over. I've had patients come in saying that they ruined their Botox because they picked up keys off the ground. And there's no evidence behind that. In fact, Botox finds its receptor within minutes of the injection. And so it has already found its way to where it's going to be working before you even get out to your car. So, why don't we see the full effect of Botox within several minutes? That's because even though it binds the receptor right away, it actually takes a little while, several days, for the proteins to stop moving across the space between the nerve cell and the muscle cell. So, my second favorite made up Botox rule, that you can't exercise after your injection. So, there was interestingly a study in 2023 that looked at patients and their level or frequency of exercise. And all it found was that if you exercise more vigorously more often, you tend to have a slightly shorter longevity of your Botox duration. So, it doesn't last quite as long, but that had nothing to do really with whether you worked out on the same day or not. There is some evidence that if you do some gentle motion of the muscles that have been injected, you get better uptake of the product. However, this is a pretty subtle finding in all of the literature. Number three, that you can't drink any alcohol before or after your Botox. So there is no evidence to show that drinking alcohol before or after your Botox injection is going to cause migration of the product or a slower duration of the product or any of those things. You might have a slightly higher risk of bruising, but it's usually not enough to matter. Most aftercare rules for Botox are typically based more on theory than they are on evidence. And that doesn't mean that they can be harmful, it's just that they probably have no scientific backing. In my opinion, what does matter is the technique of the injection, the experience of the injector, the dosage, and the product. And those things far outweigh what you choose to do after your injection. So go work out, go to dinner, go have fun, and go live your life. Botox aftercare should not be a superstition checklist, and it should not make you feel like it is your fault if you don't get an ideal outcome. So remember, good technique and patient education matter far more than any sort of daily activity that you do before or after your Botox injection. Hopefully that helps shed some light on Botox mythical rules. And if you have any questions, drop them in the comments below.